this idea is now being picked up by a number of the other agencies within the UN system, and that's encouraging. It means that there's an increasingly receptive audience or constituency out there with whom we can work as public health persons. The UN Development Programme, in its annual Human Development Report, actually took as its theme last year the risks from climate change. And you'll see in that box in the middle that it's making the point that the world is drifting towards a tipping point that could lock the poorest countries and citizens in a downward spiral. It mentions the sorts of things we've just been talking about. I think it's worth making the point in relation to that frankly, in my judgment, we just won't achieve the sorts of Millennium Development Goals that we've set ourselves with respect to the reduction of hunger, controls of malaria, HIV/AIDS, tuberculosis, the reduction of child diarrheal deaths, reductions in maternal mortality. We can't possibly achieve those against a background of a deteriorating environment. And in my view, those goals ought to have been formulated in a more integrated fashion, so that goal number 7, which talks about environmental sustainability as if it was something on its own, should have been linked in with all of the other goals, for which I think it's actually prerequisite. Now, just a bit of climate science here. This one's also a bit complex, but for those of you that don't know the climate change story in much detail, you'll have seen the sort of predictions that the Intergovernmental Panel on Climate Change has made about future increases in world temperature, and it's done this as shown here for a range of plausible future global emission scenarios. We don't know how human societies are all going to behave, but we can imagine within a certain range what the behaviours are likely to be in terms of energy use and choice of energy sources and so on. On the left is the graph of the recorded and increasing average temperature over the last century. Now, a number of climate models have been developed around the world and tested against that 20th century record to see how well, in retrospect, those models could have predicted the temperature changes that actually occurred, given the documented changes in the composition of the atmosphere during the 20th century. And you can see that they're performing pretty well within that light grey band around the observed line. So they're regarded as acceptable for trying to foresee what the future patterns of temperature change will be for those different scenarios. And for the 6 different scenarios, it shows you there what the estimated future central estimate would be, along with the range of variation, depending on the spread of results from the different models. But basically, those central estimates for the 6 different scenarios are within the range of 1.8 to 4 degrees centigrade. Now, if anybody thinks that's not very much, it's actually a very great increase, very fast. When the Earth pulled out of the last glaciation from around 15,000 to 10,000 years ago, it underwent about a 7 or 8 degrees centigrade rise over about 5,000 years. We're contemplating a rise of about half that magnitude within just 100 years. And many of our natural systems, most of our natural systems are of course not evolutionarily equipped to be able to handle that. It's not just changes in means, the weather patterns are almost certainly going to be more variable, and you can see quotes from eminent bodies here anticipating what is likely to happen, and also noting that perhaps it's already beginning to happen. Perhaps the episode in the Somalia-Kenya border region is illustrative of these sorts of extreme weather events and the health consequences that they can produce. This was an extreme flood in 2006. We also need to recognise that even though the 4th assessment report of the IPCC was published last year, the science that it drew on cut off a year and a bit earlier, and already it's showing signs of being out of date. The most recent science is showing that change in the world's climate system and the things that are immediately affected, like sea ice, for example, are all accelerating beyond predictions And although you can't see all of the detail here, in every one of those three graphs, the actual observed change since the early 1990s, with the solid line, is tracking right at the top of the range that was being predicted. So we're already way above what was regarded as the most likely rates of change. And one of the most dramatic changes that's appearing now is with respect to the loss of Arctic sea ice. You can see in this graph, very recently produced, the IPCC central projection over the coming century is shown in the red line. The actual observations from satellites are shown in the black line. Just see just how divergent those are. The world is losing ice from the Greenland Glacier now about 3 times faster than it was in the year 2000. So things are going on out there that the climate scientists have not expected, and this is why we need to be on alert and say to ourselves, we need to study and understand and communicate sooner rather than later what the risks to human populations are, and hope that that information will help to reinforce the resolve of governments to take action in relation to environment and climate change, and also put us in a better position to protect our populations. So let's think about the research tasks. Here on the left, just repeating what I've said, we've got, of course, lots of natural variation out there in the world, and that will always be there. But we've got human societies, larger numbers, increasing economic activity, pressing on these systems, and changes are appearing in many of them. And that's having effects, of course, and will have increasing effects on human well-being, health, and survival. So the tasks for us as researchers are firstly the A task. We need to understand what the risks are across that horizontal dark arrow. The B task, we need to use that sort of information to say to governments, look, we and you need to take action sooner rather than later because we foresee adverse consequences that could be avoided. And then task C, okay, the climate change is already happening, there's more of it in the pipeline. What can we do to protect those populations and particularly vulnerable subpopulations, at least as a transitional strategy? That brings me as an epidemiologist then to say, well, there's a range of research designs that we can use here. And here are what I think are the core research categories. And it's not all about modelling future risks. That's a rather new task, and we're not yet very good at doing it. Of course, we have incomplete information about the future, always. But over on the left, there are a number of immediate tasks, and these apply in India as well as they do in other countries, to understand better what the baseline climate-health relations are between heat waves and deaths and hospitalizations, for example, including in your large cities and in some of the people living in poorer housing and slums. We need to understand those things better. We need to understand what the impacts on regional food yields and food quality might mean for food affordability, local diets, child nutrition and development. We need to understand effects on various infectious diseases that occur in this region of the world. Then moving across to task 2, we can begin to look for early impacts. We can also carry out statistical estimations of what we think the current burdens of disease due to climate change might be. And I'll show you some examples of these in a moment. Then moving out to the future, we can use what we think we know to team up with the climate scientists and others to try and foresee future risks. And very importantly at the bottom, we do have to ask ourselves, anyway, how can we reduce the risks to our population by developing and testing adaptive strategies? Well, just a few quick examples. This is a well-known one from Europe in 2003, the big heat wave that killed an estimated 35,000 to 50,000 people over a 2-week period. It wasn't the only heat wave that summer. There was an average one where temperatures went up by about 7 or 8 degrees centigrade in July, and that caused about 100 extra deaths in Paris. In August, when this big one came with about a 12 degree centigrade rise above expectation, above seasonal average, it caused not 100 extra deaths, but about 1,000, suggesting that as you get to those more extreme temperatures, the graph turns up quite steeply. We're passing some sort of coping threshold, most probably, and death rates increase rapidly. And we need to know these things. We need to be doing the research so that we're better equipped to anticipate the demands on the healthcare system and to know what actions we should take to reduce risks.